This is BAIT, Life Outside the Federal Witness Protection Program. Hey, it's Susan. Welcome to this morning's episode of Keep the Bad Guys Away / Human Trafficking for Healthcare Professionals. Nice to see ya. Oh my gosh. Okay, so it is 9:13 in the morning on March 25th, 2014. And in the last hour, I've already been hit. Let me tell you how stupid people are. Okay, so I'm a human trafficking victim. And like I have said before, the Department of Homeland Security, under their initiatives such as the Blue Campaign, along with, ICE is part of Homeland Security, and then also, other departmental agencies like the State Department and, even some local task forces have programs, comprehensive programs for human trafficking victims. Okay, and there's a lot of literature out there, there's a lot of research, and there's a course that you can take online through the Blue Campaign with the Department of Homeland Security. Okay, so you know what? It is not my fault that the healthcare profession does not understand human trafficking. That is not my fault. That is your fault. I tell you I'm a human trafficking victim. It's your job to learn about human trafficking if you want to not be part of the problem and be part of the solution. Same goes for any other victim. Okay, so here's what just happened. So TravelMax, TravelMax. Okay, so TravelMax calls me and they're saying that they can't, having trouble getting references. Well, I'm a human trafficking victim and the perpetrators keep hitting all of my employment and they keep hitting all of my references. I can't help that. That's not my problem. I said, and they're like, we can't get a reference from right at Memorial Hospital. And I'm like, no, I'm a human trafficking victim. Exactly what I told this chick. I'm a human trafficking victim and I have ICE agents. And I'm not saying any more. And then she wanted me to go into more detail. And I'm like, I ain't going into more detail. I have ICE agents and I'm a human trafficking victim. So in other words, fuck off. And I hung up on her. So, and then there's this shady nursing corporation that apparently has me a contract at the Banner Health System in Phoenix keeps ringing my phone off the hook. I'm not taking this contract through this company because they're not doing housing. Why is that important on a travel contract? Because if you know anything about the travel industry, usually all travel companies do housing. Now, in my situation as a human trafficking victim, I know that if a company does not provide housing, there's also a high probability that they won't pay me. And then there's also the discrimination factor, and there could be a chain of other reasons that that could actually, be very dangerous for me as to why they're not doing housing, because they do housing for everybody else. So, if I get a contract, the company doesn't want to do housing, then I just don't take the contract. Because I know that there's something else in a pattern that will happen. Human trafficking works in a pattern. And if you followed along on my situation for 10 years, you see it. And you know what? And I can't sit there and explain 10 years of organized crime. Human trafficking is organized crime. I can't sit there and explain 10 years of it and explain human trafficking, explain that I'm a human trafficking victim and my pattern to frickin' TravelMax. So I just pretty much told this bitch to fuck off. So I'm telling you, it would be so much easier, if I just didn't have to work as a nurse and I wouldn't have to go through all this shit. Because my biggest enemy in my human trafficking situation is the healthcare profession. So anyway, I was just in Mexico the other day and I saw a bunch of prostitutes around a hotel. Apparently prostitution seems to be relatively legal and out in the open in Mexico. You know, it'd be so much easier. I could just bag 18 years of nursing, tell my RN/BSN to freaking shove it, and I can go work as a prostitute in Mexico and not have to deal with any more of this bullshit. All right, that's today's episode of Keep the Bad Guys Away, Human Trafficking for Healthcare Professionals. Take time to learn about it. It's your job to learn about it to help victims, your victim patients. I'll see you next time.